All right, we are live. This is Dr. Michael Kaye from the Center for Functional Health, and I'm honored to have with me today Karen Mercereau. She is a clinical nurse, and we're going to talk about what she does and patient advocacy. So, welcome, welcome, welcome. It's so great to have you. It was a chance meeting that we happened to meet through a mutual patient, and here we are today. I absolutely love the work that you're doing, and today I want to share what you do for nurses, and then how you help patients because navigating through our medical world is getting crazier and crazier. I think each passing decade, it's getting worse and it's getting harder for our patients to understand what they need, what doctor to see, what do they do with all the testing, how do they learn all the information from Google and the rest of the internet platform, and how they apply it to themselves. And it's so overwhelming. So, welcome,
Oh,
welcome,
Dr.
welcome.
Google? Yes, Dr.
Yes,
Google.
Dr. Google, right? And now we're having patients that have a degree, their doctor in internet medicine, right? So they actually come in knowing a lot more information. And at first, some doctors would get upset about that. Even me, I'd be like, okay, you read that. Now there's so much out there that we as professionals cannot read every single thing that's out there. So I'm always interested in learning what the patient learns by the time they get to my office. So I'll be interested to hear what you've been doing and how you help patients. So welcome, welcome.
Thank you very much for having me. I appreciate this.
So, it's like we talked briefly, like where along your journey did you decide, okay, I'm going to be a nurse. And then after being a nurse for a while, you're like, hey, this isn't working. I'm going to do something else. There's got to be a better way to deliver my knowledge.
Well, my father, who was paying the bills for college, said that I could be a nurse or a beautician or a teacher. So I picked nursing because that's what my mother suggested. Anyway, so I graduated in 68, started out at Georgetown University, and worked in as many venues as possible, including air, flight. Um, I have done two national programs. The first is nurse credentialing, that was in the 80s, allowing nurses to have a career ladder to grow. And that was the leading program in the nation at that time. And then in 2002, after 34 years pretty much in ICU, I quit. I was working PD ICU, Dr. Kaye, and I quit. I quit because things were going south in the healthcare system as far as I could see. And I was always following the healthcare system to see what was going on. And I thought, some people need me. I said, people need somebody by their side who understands the language, who can protect them, who can advocate on their behalf. And I thought, this is a great idea. I put up my first baby website, and apparently I was the only one on the planet doing this at that time, because I heard from Europe, I heard from the Middle East, I heard from Canada, and all over the US. So I thought, well, I'm on the right track. Now I have to figure out how to do it. Took me 7 years working with patients to actually finalize the RN patient advocacy process, which is now at the copyrighted at the Library of Congress. In fact, the entire program is. And it was after that that the University of Arizona picked me up, because this is a new practice model and they wanted to see what I was doing. And working closely with them, they helped me develop an 8-month program teaching nurses how to do this. I was responsible for content. They were responsible for helping me put it online. And I've taught probably almost 400 nurses around the United States how to do this. This is, as I said, it's all at the Library of Congress. This is unusual in its extent that it works with all branches of medicine, not just traditional Western medicine and big pharma, but also advanced science, such as systems biology, or how everything in your body is connected. the human microbiome, which pretty much runs things. It's your second brain, and inflammation. So anyway, when a patient calls, I interview them. What do they want? I'm not there to make decisions for them. I am there for three main reasons. Number one, to advocate on their behalf. What's happening? Who are they working with? Working with their providers. I build teams so they are working with the correct providers in addition to the ones they're already working with. Teach them how to ask questions. Teach them sites where they can go to learn, not just Dr. Google, but how about at NIH, the National Library of Medicine, which was written in lay language with lots of pictures. I mean, teach them where they can go for accurate information. So advocate on their behalf. Education. People, it's highly unfortunate that health literacy in the United States, even with a college degree, is in the sub-basement. People don't know how to read science. Nurses read science. And of course, I teach them in this program how to read science even more intensively. Anyway, they don't understand what's going on in their bodies. If they don't understand, very often they're not compliant with the treatment plan. Yeah. So they're not getting better. So one of the things, in addition to the advocacy, is I create an education plan right off the bat after interviewing them extensively. What do they need to, what do they know? What do they need to know? And how is this sitting with them? Once again, it's not my job to tell them what to do. It is my responsibility as an RN patient advocate to help them be informed so they can make the best choices based upon what they would like to see happen. Yeah. And then the third main piece, and there are lots of elements in each of those, advocacy and education, but the third major section is guiding them through the healthcare system. As you well know, Dr. Kaye, the healthcare system is a maze, and it's getting more maze-like every year. And if you don't know the language, and if you don't understand what they're doing, docs, you might have 4 or 5 docs, they don't talk to each other.
Nope.
And I must say, doctors have not become substandard. Neither have nurses. What's important to understand is that docs are caught in the same substandard healthcare system as everybody else. And so frequently, they may be called upon in the insurance system to see 30 patients a day. What if you've got a 65 or 70-year-old person with 3 chronic diseases and they've got 10 minutes with the doc? How do you think that's going to work?
It's not.
They really need an advocate.
Right.
Anyway, that's a very brief overview.
So you don't work with a doctor's office, right? You have your own business, right? So how does a patient know to reach out to you? Like, I didn't know until you actually reached out. This patient reached out. I didn't even know you guys existed. Now that I knew you guys exist, like, my God, you can help so much, especially a demographic population that I see in my office that don't do well on the internet. You know, my elderly population. I mean, a lot of times I'll order something for them on the internet because they're not comfortable with it. But it's very overwhelming for them. And sometimes they have to make some very big decisions. So now that I have you guys, I can tell my patient, like, hey, you need to start here because it's so much, right? So they're listening to what their neighbor has said. They're listening to what their children say. They're maybe listening to a pastor at the church. Maybe if they get on the internet, they're listening to that person. Wow, it's just so overwhelming. And I'm assuming this is where you guys come in and take the bull by its horns and say, this is where we need to go. Because a lot of times they're getting information from the doc, and not that the information is wrong, but maybe there is another way, right? Maybe it's not just this treatment. It could be a different treatment. I know in my office, when we have to go for a second opinion, I'm a third opinion kind of guy. So I want at least two of the three opinions to have the docs on the same page, and I want it from two different outfits. I
You
don't
you
want
just said something very important, Dr. Kaye.
Mhm.
Doctors don't have time to speak with one another. So
Correct.
you might have 4 or 5 docs, and they're not talking to each other unless they are like you and in independent practice and not beholden to the healthcare system.
Correct. Correct. And I am so fortunate, so blessed that we have created this team of people where I get to have this conversation with the doc about my patient, saying, "Hey, this is our presentation. This is what we're doing. What can we do as a team next?" We always hear about these Hollywood stars that have teams of doctors and the best doctors, and we always hear about these athletes that have these amazing doctors and a team that works for them. Like, why can't we have that team as just Joe average patient?
Well, we can, and that's part of the responsibility of an independent RN patient advocate, putting teams together. Let me give you an example, an extreme example. Several years ago, I got a referral to a patient, 65 years old at the time, who had stage 4 non-small cell lung cancer, the most aggressive. He was given 2 to 2.5 years, and then they found me. And I was able to put together a team, and I'll tell you about the team in a minute. But because of that, we were able to give him quality of life for 8.5 years. This
Wow.
is not magic. This is working with a team. I know a lot, but I'm not the only brain in the room. Putting together with functional medicine, naturopathic oncology, keeping him with mainstream onc as well as radiation onc, putting together with nutrition and doing a tremendous amount of teaching with him and with his family to support him going through the treatment program. That's how we do it. You have to have a team.
Hmm. Definitely agree. It's hard though, because again, when docs are stuck in the system, they're in their own silo, right? So I mean,
Yeah.
sometimes I don't have the opportunity to rotate through hospitals, rounds in the morning or anything like that. So once in a while, I actually have to see a doc for something. Like, oh my God, it's finally great to meet you. We've been sharing patients for 10 years, but we don't get out of our little enclave. So in your type of business, how does the journey look for the person that comes to you when the patient calls you and says, "This is my situation"? Where do you guys begin? How do you take them along their journey to give them the best team?
Well, an extensive intake. Um, the RN patient advocacy process has at least 20 steps. And if you do the steps, the first is screening. Do they actually want an RN patient advocate? Do they need one? Um, and then an intake. Where are they? What's going on? Is their family involved? Always involve the family if at all possible. Um, and come up with an advocacy plan, which is an evolving document, and also come up with an education plan, as I mentioned earlier. One of the things that, referring back to docs of being aware of what everybody else is doing, one of the documents that I create, and you haven't seen it yet, is one that I call the Medikey. Once again, this is at the Library of Congress. And what we do is collect all pertinent background information going back. At one time, I was able to go back 40 years.
Wow.
What doc is doing what? How are they working with each other? And this document goes to every single patient. Now, I was able to start one on one of the patients that we're working with together, and I'll go ahead and send that to you so you understand what I'm talking about. But this is a way every doctor needs to know what everybody else is doing, and this tool allows that to happen.
Very, very cool. Yeah, because a lot of times patients will come to us because we're in this setting in the functional medicine world where they've seen a bunch of docs. Docs do the lab work, they'll do some studies, and they'll say, "Yep, everything's normal." So if everything is normal and you still feel bad, it's got to be in your head, right? So it's got to
Yeah, well, we're not looking in the right room.
exactly, exactly. So and it's so easy to fall to the diagnosis. Well, you must have anxiety, you must have depression, or you must be hormonal, you must be getting older, right? There's all these things that I hear. I've been hearing for decades. We're going on 37 years of practice, and that story hasn't changed. It's changed some, but it really hasn't changed, right? So I think now with teams, we're starting to look at things a little bit differently. I like that. We're not looking in the right room. And I think that happens quite a bit. So when a patient sees you, they filled out this extensive paperwork. So do you look at them also from a physical perspective? I mean, you and I have talked about the microbiome. You shared some wonderful, wonderful slides with me. Um, do you guys physically look at it? Well, is there an exam that's involved?
Um, as an ICU nurse, I know how to do, a full body eval. However, most of my patients are not. I do remotely, so
Okay,
no, I cannot do a full body eval.
gotcha.
If they are close enough, then I do that and report my findings.
Excellent. So you get the opportunity to review their paperwork, right? And you also look at their meds. I notice, and please talk about this. We got this guy giving a med here. We got this guy giving
Oh,
a
Lord of mercy,
we got this
yes.
guy. And then on top of that, they go to the health food store, they get this supplement over here, they get this supplement over here. This one's fighting this one, this one's fighting that one. So how often do you see that presentation?
All the time, particularly with elderly patients who may have 4 or 5 docs, and they're all prescribing different stuff and nobody's looking. So a few years ago, I created a program called the Medication Safety Program. One of the things that we are looking at is interactions. Many mean that you have to stop them. Perhaps pick another choice in the same drug class. There is a site, as I mentioned, called drugs.com that does an interaction checker. Anyway, another thing on medications, in addition to the interactions, is nutrient blocking effects. For example, there's a great place called Coastal Pharmacy that has a great chart. And the one that really sticks in my mind right this minute are proton pump inhibitors.
Yep.
And Nexium, Prilosec, etc. And they block magnesium, critical for heart and brain. They block calcium. Yes. For, if you're on proton pumps for a long time, more than the suggested 3 months, then you run a risk of osteoporosis. And there are certain drugs that should never be prescribed for patients over the age of 70. And there are charts that can teach you that. Anyway, so the medication safety program goes into all of that. And I do that on all my patients where it is, necessary as well.
Yeah, the nutrient depletion checker. So we use both the interaction one and then we use the nutrient depletion checker because we know when somebody's on metformin, it just beats the heck out of B12, right? We know that. We know if they're on a statin, we're going to support with CoQ10. These are just some important things. If they're on a PPI, I got to support with magnesium and calcium. I once read that the PPI was supposed to be 6 weeks to 3 months and done, not 6 years to 9 years.
Or for life.
Life, right? And what we'll often see is that the patient wants to come off of it. They'll decrease the dosage. They get a rebound effect. Doctor says you got to stay on it.
Painful, yeah.
And they just continue the process and never get off. So when we're taking somebody off, so the GI will say, okay, we're going to take you off of the proton pump inhibitor. I'm going to come in from this side and say, okay, we still need to support what's going on. That's where we'll look at stuff like, glutamine, DGL, slippery elm bark, elm root, marshmallow root, elm bark, all that kind of stuff, because we want to still coat this, right? We still want to protect the esophagus. Now, sometimes they don't have a choice because they got Barrett's esophagus and they're like, you just got to be on the PPI and that's it. That's a lot of the traditional gastroenterology thought process. And I'm like, okay, that's fine. But then we still need to support the gut. We still need to support that microbiome. We still have to help the esophagus. And that's where nutrition plays a large role. So when you see your folks that come into you and they got this problem, that problem, this problem, nutrition's got to play. You got to think about nutrition. How does that play a role in what you guys look
Oh,
at?
nutrition is key. Is key. I work with integrative nutritionists all the time, and functional physicians also are heavily focused on, like yourself, on nutrition. That is essential. I know some. I'm not a nutritionist. I reach out and
Right.
work with those whose entire work is in integrative nutrition. One of the things that with people on proton pumps and with trouble digesting, that has proven to be helpful, are pancreatic enzymes, especially for digesting protein,
Yep.
and that also helps to protect the microbiome.
Yep. Yep.
I suggest frequently that people where they're on several meds, I know their microbiome is dysbiotic. Yeah.
Mhm.
And what are we going to do to fix that? You want to talk to that?
Right. Right. And a yogurt isn't going to fix it. Right. So so we want to be conscious of that, right? And I, I I think many of our patients, they fall prey to the marketing aspect of things, right? And I don't blame them, right? They don't feel well. They can't find the answers with their traditional GP. Sometimes they can't find even the answers with alternative healthcare, and they're just irritated and they're at their wits' end, and they read a good piece of copy, and it sounds so promising that this new probiotic is going to change things, and it's only $89.99 with a subscription with 5% off. And it's not always the answer. So I do get it. It's frustrating on both sides, right? You can see that, and people complain to me every time I go to a doctor. They give me medicine. I'm like, well, that's what they went to school for, right? I mean, that's what you're gonna doc. But on the flip side, even in my world, it's like every time I see that, they're always giving me new supplements, right? It's like, well, they're trying to help out on this side, right? So I think there's that balance we have to find where we can blend, and this is what we've done in our office. We blend both worlds. Yes, we need medicine. There are times where you're going to need an antibiotic. Okay, that's great. We know what that antibiotic is going to do to the microbiome. We know that. We now know, though, that when we take a probiotic with an antibiotic, not only is it better for your gut, but it's better absorption of the antibiotic. It actually works better. So there's all those cool things that we learn. So when a patient comes to you, they've got to be so overwhelmed. You have to deal with the patient, but you also got to deal
Have
with the
to
patient.
listen. You gotta listen where
Right.
they are.
So dealing with the patient's family can be very difficult. Now, I don't know about you, but in my end, I can speak to a female patient. They're not, they have this issue, and then it ends with, well, I'm going to have to speak to my husband.
Oh,
And
I encourage them to be on the phone.
so do I, right? So a lot of my female patients suffer with husbanditis. And and they don't allow their wife to move forward with care a lot. So when you are seeing your patients, you got to be dealing with them and or their sons or daughters or the significant other. Where's the pushback that you get? Where is the pushback from family members or significant other that we don't want to do this, we want to do this? What do you see? What has been your experience?
Well, to be honest with you, the biggest problem has been with elderly people who think the doctors know everything. And the doctor says, and they're talking about mainstream docs, we're not talking about integrative or functional advanced science docs. That has been the biggest problem. And I'm very skilled in the change process and going from unfreeze, to freeze again. And that's how I help them through that. I do a lot of listening, skilled interviewing. So that's been the biggest problem. It hasn't been with family. It's
Okay.
been with older people who think what they don't realize is that half of the docs in this country graduated in the bottom half of their class.
Right.
The, you know,
Yeah. It's funny.
they're not bad. They're operating. They're not life learners. Um, they don't keep up. And big pharma has a big piece in that. They write a lot of the curriculum in medical schools. They're not teaching advanced science. They're not even teaching nutrition. There are 2 or 3 med schools who have a 1 4-hour course in nutrition. And PS,
Right.
nutrition builds us.
Right.
And if
Right.
you
Right.
don't understand that,
Can't move
you're
forward. You
missing
can't
a
move
big,
forward.
yeah.
Right. I always like to say the power of health is at the end of the fork. Right. The power of health is at the end of the fork. The problem that a lot of my patients come into, and maybe you can speak to as well, is that they're so overwhelmed. They don't know what kind of protocol to follow. Is it carnivore? Is it veganism? Is it vegetarianism? Is it low carb? A low FODMAP? Is it histamine? Is it candida? And you can see the frustration, right? You can definitely see the frustration, and it's even compromised further by having all these different docs saying some different things. And a lot of
Well,
docs I work with, they're stuck. They're stuck in the corporate world. They're stuck. They have to keep to the narrative. They have to keep their job, and I get it. It's just getting harder for the patient. That's why I really like the work that you do, where you can help them navigate through this system. So, do you ever get on the phone with the doc?
oh yes, absolutely. And when possible, I show up in the room. I show up, and I'm the last one to talk. I'm there to listen and I'm there to ask questions, but I do not interrupt. I do not go in with big boots on. You don't get anything done with big boots. Um, and that has proven to, in the very beginning, back in 02, 03, 04, they thought that being an advocate was there to cause them trouble, to show that they were doing something wrong. Not my job. Not my job. My job is to figure out what they're doing and to ask appropriate questions. For example, I had a 75-year-old guy whose ejection fraction was 32. He
Mm,
had fallen down, and they were going to stick a pacer defib in. And I said, "Whoa, Mama, that's not quite what I said." I asked the cardiologist with whom I had worked before if he would give me 2 weeks, just 2 weeks, to figure that to see if there's another way. And I look globally. I don't look just in the United States. There's a lot of work being done, excellent work globally. I found the European Journal of Heart Failure that found that there are 4 things to be considered. 4, not just the ejection fraction before you stick that thing in her chest. And my patient, the only thing that he was a problem was the ejection fraction. The other 3, he was fine. So I took this into the physician, the paper, the report, highlighted and underlined, and he looked at it and he said, "This is amazing. What can we do?" And so there are supplements and dietary approaches. And I went over all of this with the cardiologist, who said, "This sounds really good. Let's try it." And within 3 or 4 months, he started climbing. We eventually got him up to 45 without the pacer defib. Um, so, labs are very important. Um, don't just jump to conclusions, you know, based upon traditional, give them a
right.
drug, do surgery. That's it.
So, when you speak to the nurses and the docs that are in Europe or wherever you're speaking into, is it strikingly different?
No. Well, I shouldn't say that. Italy and France are much more forward looking than we are. Great Britain, I was working with one of the leaders at one point of the whole nursing program in Great Britain with the National Health program. And they were moving forward, but not as fast as France and Italy. So I learned, I mean, Japan, oh, they are leaders. you know about hyperbaric oxygenation and what it can do. When they have a patient who is calling in and they're having an MI or they're having a CVA, they send an ambulance with hyperbaric right in it. They stick them right in the chamber right away. I mean, how advanced is that?
Yeah.
You know, they're very forward looking, and as I said, I look globally. I learn.
And what is your opinion on why do you think like it seems like some other countries are forward looking with healthcare and sometimes we're a
You
little
look
bit
at their outcomes.
you know.
You look at their outcomes.
Yeah.
You know,
Because I've had patients that travel to other countries and they've gotten batteries of testing from MRIs to CT scans to cardiac testing for hundreds of dollars, not thousands of
hmm
dollars.
hmm
So you sometimes wonder like, what are we doing here? Like we have there's now you can get a full body MRI now, head to toe. I think about $2,300. They got one in New York, California. I think one in Chicago. It's really interesting.
Well,
$2,300.
you want to talk full body, not only full body MRI. How about a full body thermography, which
Right.
can pick up cancer 10 years before any mammo or any other testing? I
That's
mean,
not
why
normal.
isn't that being promoted?
Right. Right.
Come on.
Yeah. I mean, I remember thermography came about and then kind of like it's just went away. It's like it came in and went away. We don't
Unless you
see a
meet
lot of
Karen.
thermography centers. You know? What's that?
Unless you meet somebody like Karen.
Right. So where are off your head, if you can recall, like where are some thermography centers on the East Coast?
I would have to look it up. I mean, I don't carry all of that in my head. I just look stuff up. I look stuff up. I know how to look stuff up. Uh, I'm very good at looking things up.
Well, talk about I had to look stuff up. I mean, I think that's part of our issue. I mean, especially when we have articles that come out in the medical world, knowing how to interpret an article, and then patients go on the internet, they don't always know how to interpret a
They don't
publication.
read science. They
Yeah,
don't
they
read
don't.
science. You have to actually, this is one of the things that I do on my website. I have something called the Healthy Body Herald, and I take mainstream medical and health science articles and I translate it into lay language, into English. Yeah. And with live links for those who wish to dive a little bit deeper. You have to make the information available in a way that they understand. I mean, I read science journals and medical journals every day. There's a huge amount of information that they need to know, but they don't know how to read it.
Right. So the question is, do they really need to know, or they just need to align themselves with, like people like you, so you can help them, right? Because I mean, it takes a certain amount of, years and understanding of language and being able to pull together an article to, learn. You have to have research and methodology. You got to understand how statistics works, and it's very heavy. I mean, and I'm published twice, and the type of publishing I did was on case studies, but they like to look at, randomized control trials. They look at like meta-analysis, double blinds, all that. Yet as a practicing physician in the field, it's the actual case studies that are helpful because if somebody has X and I can call a doctor and say, what did you see? How did you work it? That helps us out quite a bit. So in you help patients, but your program is you also teach other nurses, correct?
Oh, absolutely.
Right.
Right
So
now, I am teaching 6-week programs on advanced science. A lot of the PowerPoints I've sent to you on systems biology. That's 6 hours. Microbiome. That's 6 hours. Inflammation. That's 3 hours. I've got a class on inflammation coming up in a couple of weeks. That's 3 hours. I haven't, the last 8-month program that I did finished up in 22, and then I had to move cross country. And so I haven't done another, although they're still writing in and asking for it.
So do you think with each passing year, there are more and more nurses that are gravitating towards
Oh, yeah.
this type of setting?
Nurses are leaving the clinical bedside by the thousands, as I'm sure you know. The reason being they're treated very poorly. When there are staff cuts, it's always in nursing. We've got nurses' aides going in and doing evals at the bedside. What? And politically, they are stymied. Every RN is taught to be a patient advocate, but they're not able to do it. And so politically, it's difficult, and they're just leaving in disgust. And I try to catch them
Yeah, I
as
mean,
best I can.
I know during COVID, nurses were just getting hammered. Yeah, we're getting good pay in some places, but just getting hammered. And I think after that has quieted down, I think that's where they said, you know what, I'm out. I gotta go do something different. Um, so would you
Well, they
tell?
can be a health coach. They can be an RN patient advocate. I mean, there are some different ways that you can go. You
Right.
know.
That's why I think, being and now I remember like we had a whole bunch of RNs. I remember was it in maybe 2000s. It was kind of like, all right, all you folks that are RNs, you now got to be BSNs. And a lot of hospitals were sending everybody back to school to get their bachelor's in science and nursing. Um, because they said we have to have you guys have a bachelor's. I don't know how that started. RN seems to be doing the same thing as the BSN. Maybe they do more now. I don't know. I know the nurse anesthetists do well. I know that I love working with the certified registered nurse practitioners. They have been
Oh, nurse pracs are
great.
marvelous,
Yeah.
but they're not taught advanced science.
So they're not called advanced science. So can you let's share a little bit about that? Can you share like the difference between what you're delivering
I
and the
worked
CRM?
closely with the University of Arizona College of Nursing for 10 years. Yeah. And
Mhm.
they have one of the nation's leading nurse prac programs. And so I'm very familiar with what's being taught, and they're excellent. Oh man, I tell you what, my primary is a nurse prac. That's what I think of nurse pracs. Anyway, they they're taught traditional Western medicine. They're not taught advanced science. I got a problem with that.
Yeah.
Although
I
they
mean,
do listen. I mean,
the,
they'll spend an hour, hour and a half for that first intake. And they're marvelous. They're
right.
wonderful.
I can tell you that the nurse practitioners I work with are damn on the ball. They're really good, right? I mean, they're I mean, I said they find things that their doc that they work with didn't find, right? So
Well, they're looking.
exactly. Again, so I think they'll look into, like you said, they'll look into the other rooms, for sure, for sure. So
They're
what
listening. They're
what does
listening.
the training look like for a nurse that starts your program? Like
Well,
is
there's
it
a lot of homework
online or
they have to do before they can even come in. Well, first of all, they have to fill out a several page questionnaire, which will tell me if they're ready or not. If they're not ready, I tell them what they need to do to get ready. Yeah. I mean, I may send them back for to a community college for learning how to write. Because you're going to be writing to nursing hospital administration, you're going to be writing to docs, you're going to be writing to professional organizations, and you have to learn how to write. I mean, it could be as simple as that. So they have to fill out the questionnaire, and then they have to have an hour and a half interview with me or one of my RNPAs that I've taught how to do that. And if they come out looking okay, then they're accepted into the program. And at which point they have a lot of homework to do, videos to watch. Bruce Lipton talking about cell biology is really good.
yeah,
Um, there are there's a lot of work, and then I pair them up. Usually, I have three or no more than four in a group in the same time zone, if at all possible. So they're doing their homework together. They're learning from each other. You get into this program, you're advanced already. You are a life learner. And so they learn from each other. I practice participatory learning. I mean, just lecturing can be very boring.
mhm,
Wham goes the
yeah,
eyes. And so I involve them in the whole learning process. Works really well.
Nice, nice. So, how long is the process? Is
The
this
whole
three,
it's 8 months. There's 23
eight
modules.
months? 8 months. Okay, that's great. So, of the docs that you've worked with, right? So, who don't name a name, but of the disciplines, I should say, right? Who's
Oh,
the tough?
naturopathic oncology, Dan Rubin, who wrote the board exam for naturopathic oncology, he was on my faculty for more than 10 years. One of the advanced integrative nutritionists was on there. Mary Ackerley, Harvard-trained psychologist or psychiatrist rather, who practices advanced. Um, I have I do some of the teaching. I have other RNPAs doing some of the teaching. I pull in docs and other, uh, I pull in a lot of business people as well. You're going to be in business, you better darn well learn how to do it. So that has to be part of this as well. Advanced lab testing. I mean, there's a huge amount that's in there. If you wish, I will. I can share that with you.
Yeah, that would be great because it's always good again because we're always looking to build out our teams, right? So that's important. My question though is of the disciplines that you work with doing the advocacy aspect of the business,
Mm.
who's the most difficult to work with? Is it the orthopedic
Main
guy?
Street,
Is it
no, no.
oncology? Who's
Well,
who's
the
who's giving you the most stuff?
orthopods are a little bit difficult. Cardiologists, I remember being in a cardiologist office and he had somebody on statins, and I raised the issue very politely, very respectfully. How about, you know, coenzyme Q10 and maybe even PQQ?
Yeah.
Anyway, he right in front of my patient, he reamed me out. Yeah. Or in VA hospitals where you've got the attending and then you've got the ducklings, I call them, you know, the whole team. And there was a patient who had major immune issues, and I suggested vitamin C, IV, vitamin C. And he read me the riot act right there in front of God and everybody. So yeah, cardiology is not real open. Orthopods are not real open. But it depends, you
Right,
know.
right, right. I mean, I am like I found two cardiologists that are just so outstanding and understands what we do. And they'll tell the patient, all right, Dr. Kay's done all the blood work. I see what he's doing. If you do what he tells you to do, we may not have to put you on any medication. But if you don't do that, he's going to tell you to get on the medication, right? So they give me that freedom. They'll give me like, hey, if you can change this person in 3 to 6 months, if you can change your cholesterol, if you can bring their hemoglobin A1C down, it's great. We keep moving forward. That was hard to find, right? That was hard to find to have somebody have that thought process. I'm not stepping on their toes. I just want to say, hey, what can we do as a team? So when a nurse goes through your program, do they end up working on their own then, and they get their
Yeah,
own
yeah,
website and stuff like
yeah,
that?
they work on their own. They may open a practice and they'll pull in PT, or they'll pull in a nutritionist. You know, they may pull others onto their program, but most of them work independently. There are 2 or possibly more, but 2 that I'm thinking of right now who are charging $250 an hour, and they're getting it. I don't
Wow.
charge that. I mean, there's a big practice up in Donna Hartelius up in Montana, and then Nan Weatherhorn down in Miami, who's done some amazing work. Um, most of them are about 100 to 125 an hour.
Gotcha. And what do you feel? What do you see as the biggest challenge when somebody comes in? Like the underlying common denominator, like you just see this all the time
You mean with nurses or with patients?
with patients.
They just don't know what's going on and they're scared and they're angry.
Okay. And over the years you're practicing, what challenges do you see has improved?
I don't see it improving. The healthcare system is getting more obstructive.
Mhm.
They're, you know, they are refusing to pay for a whole lot more than they used to pay for. Um, it's all about making money. It's not about wellness. What they call preventive medicine is a colonoscopy. Come
Right.
on. That's
Constant
very nice.
mammogram. Yeah.
That's not a preventive medicine.
Right. Right.
Anyway, I'll get off my soapbox.
So what role do you feel artificial intelligence will play, AI, in the future? Because I'm really
Oh,
seeing a
really
lot of that.
good. Really good question. In the beginning, I was hesitant because I doubted the integrity of the information.
Mhm.
I didn't see anybody checking it. And then I talked to a cousin of mine, is an MD, Dr. Wendy Angelo, who has spent her entire career doing informatics. And she has taught me a lot. So I think there's a great deal of value, but once again, you have to check the integrity of the information.
Right. Yeah, I definitely think it will play a role. I think it'll play even a bigger role 5 years from now,
Yeah.
or
Doctors'
even
notes
sooner.
are written with AI.
Say again?
A lot of mainstream docs are writing their notes with AI.
Oh, yeah. There's
Chat
now
GPT.
yeah, there's now software that will listen to the patient and the doctor and then will create a soap note out of it, you know?
Yeah. So I think that it has promise. It all has problems also as well.
Well,
What
it's
do you
just
think?
I think it'll be interesting. I think AI is gonna play a role where a lot of patients now are putting in, like, their symptoms and then coming up with a conclusion. They still can't doctor themselves. It's coming up with an answer. What it's giving them is some language. At least they can go to the doctor and ask them about what they found, right? So I feel the
If
internet
they
will
do.
right, if they do, right? So and if it's if what they look at is actually true, right? So I think the internet gives somebody like if you have something, like you went to your doctor and he says you have X, and now you look up X before you get to your second doctor.
Oh God.
At least you can learn the language associated with it, right? So if somebody says, if you see your primary says, I think you may have lupus, you're going to go to a specialist who's going to look at you. At least you get the opportunity now to look up what lupus is about and learn the language associated with lupus so you can formulate some good questions to the specialist that you will see. So that's where I think that will
If
work
they do, when
if
you
they
Google something like lupus, right? And you
correct.
know what you get, and it's all AI writing this. But if
Correct.
you follow down and it asks for you click on more information, then
Right.
they will actually give you links to organizations that can teach you more
Correct.
accurate scientific information. I don't know how many people click on that.
Right. I don't know if a lot do, but I will say, because we have that accessibility, at times it can be helpful. Where years ago, there's nobody that's going to go to the library, right? Nobody's going to get a diagnosis, go to a library. I don't even know if my patients know where the library is half the time, right? Nobody even uses the library as much as I do. I can tell you that. And look for an encyclopedia that's within at least the last decade, right? And try to look up the information. We have just everything so accessible. So I think it's absolutely wonderful that we have this accessibility. We just now have to use it properly, right? That's the big
Integrity of
thing.
information,
Correct,
following the links.
correct, correct. And I always tell my patients, good info. I like it. This is what applies. This is what doesn't apply. How do we move forward? And that's what we look for, right? So moving forward, we always look at like what kind of metrics can we use to ascertain how you are doing. I think that's really important, especially when we're putting together a team of people. So I just really love the work that you do. I think a lot of my patients come in so overwhelmed. I have daughters and sons of parents who are older now, and they're just really going through the system, and
Yeah.
it's not good, right? They don't know what to do. Um, so wow, thank you for spending time with me today. I think it's really fantastic.
Oh, I've enjoyed it. Thank you very much, Dr. Kaye.
So,
I've enjoyed.
but before you leave, I got just two questions, and one is of the work that you've done. is there one case that really stands out that really just sits in the brain that you really think about? So that's question number one. And the last question is an easy question. What book are you reading now?
Oh, shoot, which one? Um, um, as far as cases that stand out, the one that we were able to extend his life by 6.5 years, that was pretty cool. And then there was another case, a 62-year-old lady who called, and she had been given a diagnosis of non-Hodgkin's lymphoma, B cell type. And she was stage 4, and she was not doing well. She was with a primary and a mainstream onc, and they told her that she should go home and get her affairs in order. Well, she had heard a little bit about the work that I was doing, and she called me and said, "Is there anything we can do?" Yes. Put her with a functional doc, put her with naturopathic doc, keep her with her mainstream onc, put her with nutrition, and make certain that the right labs are done at right intervals, so we're tracking therapeutic progress. And within 3 months, her labs were turning around. Within a year, she was cancer-free. She's still cancer-free. This is not magic. This is just knowing how to do it. It's pretty cool.
So you mentioned naturopathic doctors, though. So I'm back east. I don't know where are you at?
I'm back east now. I spent most of my life out in Arizona.
So Arizona, California, Colorado,
You're more
Oregon,
advanced.
Washington.
Yeah.
That's regular practice.
Yeah. Bastyr. Oh, I'm real happy.
Yeah,
to put
Bachelor
them through
University, right? So I
Bastyr.
mean,
Yeah.
we don't have a lot of NDs here.
No, we don't.
You know,
Which
they're
is
good docs. You know,
there are
very
some NDs in New Jersey. There are none in New York. They are in Connecticut. I don't know. I haven't checked in Massachusetts. It's unfortunate because they do a lot of really good work.
Yeah, they're. I think they're really great docs. I know University of Bridgeport, Connecticut. I think they turn out an ND degree. But yeah,
Yeah.
I mean, they're good. Okay, cool. And then, what book are you reading?
Well, right now I'm reading 3 mysteries because during the day I read 5 newspapers and I read about 3 science journals. And by the time it's lights out, it's time for Karen to relax. And so I read fiction. So, I read Science Daily. I read the Anesthesia Journal. I read BBC, the medical journals. I read, shoot, I can't even think of them all right now.
What journal don't you read anymore?
I'm not real interested in ANA, the American Nurses Association. They need to get out of their office and find out what's going on. I don't read stuff from the AMA anymore because they are wedded to big pharma. And as far as I'm concerned, their information is skewed. I read a little bit about mainstream onc, find interesting stuff. I read genetics. I read a lot of the stuff from Jeff Bland and Mark Hyman on functional medicine. I'm out there looking at the edges and evaluating as best I can with the information that I have at hand.
Fantastic.
I'm a learner because I must. My favorite word is why?
Right. No, that's fantastic. So how do people get in touch with you? Just go to your website. Can you give me your website and all that kind of stuff?
Yes, patient www.patientadvocates.com. You can have a free half an hour with me, and we'll discuss whether or not this is something that you would want to do.
Fantastic. So again, thank you so much. I really appreciate you spending some time with us.
You're welcome.
The replays as well. So everybody, thank you and have a great weekend, and we'll talk soon.
Thank you.